Now for up next, we are looking at two types of incision, which are basically used in the abdominal region, okay, when they want to do a surgery, okay, at the abdominal region. This is a suprapubic incision and the subumbilical incision. So we're now looking at how they actually do them and reasons why they will actually want to do them. So for suprapubic, of course, you know, is above the genitals, okay. Then subumbilical should be under the umbilicus, okay. So any incision down here, any incision at this region that is under the umbilicus. So these ones, they're actually common surgical approaches if you want to do any abdominal surgery, okay. You use these two. So they mostly use them in obstetrics and gynecology. So for suprapubic incision, location is just above the pubic bone, typically 2 fingers width above the symphysis pubis. That's what suprapubic. This picture above the pubic, okay. So it can be done transverse, okay. So commonly the incision we look at here is what the Pfannenstiel. All right, most of the times we are talking about, you know, suprapubic. It's usually used in cesarean section or any gynecological surgery where they want to actually access the cervix, the uterus. So advantages: there's better cosmetic outcomes because it aligns with how the skin moves along that place. There's lower risk of wound dehiscence or hernia. So there's less interference with post-operative respiratory movement. So disadvantages: there's limited exposure to abdominal structures if you want to, you know, approach abdominal structures too. So maybe associated slightly with more blood loss, okay. So for the subumbilical, which happens to be here, anything below the umbilicus but not close to the pubis though, you know, it's just below the umbilicus. It's often vertical and midline. Can you see a line down? Okay, so it's preferred in emergencies where you can actually access more structures using that. So it's quick, easy access to the peritoneal cavity, can be extended superiorly for greater exposure, less blood loss due to a vascular midline plane. So disadvantages: there's higher risk of wound complications like dehiscence and hernia, longer closure time, and less favorable cosmetic results. So surgical decision factors, that's what will now make you want to make a decision, you know. Patient's body habitus and urgency of the procedure, need for exposure, previous abdominal surgeries, cosmetic considerations. Oh, seriously?